Okay, calling the meeting to order of the County Health Committee. First order of business is the approval of the January 26, 2021 minutes. Do I have a motion? Okay, Beth,
So moved.
and Linda second. Okay. Are there any changes, corrections, or additions? No? All those in favor? Aye.
Aye.
Any nays? Okay. Yeah. We have Rob and
Yeah. Member Blair, how do you vote on minutes?
Aye.
Okay. And Member Renault?
Aye.
Okay, that's
Motion carried.
unanimous. We're moving on to informational items. We'll start with Monica, the Board of Health. Hi, Monica.
Turn on the microphone, Monica.
Hello? In your packet is our December 21st Board of Health minutes. More than happy to answer any questions of that, as well as to give a brief update related to our current COVID vaccination campaign. So to date, for Peoria County, overall, we've received close to 40,000 doses. For those of you who may not be aware, the doses are allocated to your local health department. Local health departments then can redistribute the vaccine to different entities. So for us here in Peoria County, of the 40,000, we've actually partnered with OSF St. Francis Healthcare System, UniPoint Health, and Heartland Health Services to distribute the vaccine. They've largely taken on the role of doing the 65 and older population. That is why if you go to the Illinois Department of Public Health vaccine website for data, you'll see that Peoria County is leading in terms of the individuals 65 and older that are being vaccinated. We're using an existing infrastructure of people feeling comfortable getting their vaccines through their healthcare provider. Likewise, for Peoria County specifically as a local health department, we've done just over 9,000 doses of first doses and 3,000 second doses. Many of our doses are done through the Headington Oaks Clinic, which approximately does about 1,200 to 1,500 first doses. And then we have a strike team that we work through with AMT that goes to different senior supportive housing, such as Southside Manor, Heartland Apartments, as well as other entities that may have issues with mobility or transportation and actually get vaccinations done there. So that 9,000 is a complete first dosing of just our health department team, and then again another 3,000. This number will drastically change. This is the largest week we have for second doses, and so we will have that increase here shortly as well.
Any questions? Steve?
Thank you for the update. I think last month you talked about the administration of vaccines. Some of it comes through the health department and other comes through the state of Illinois. Was I misunderstanding that there's two different channels that bring that to the pharmacies versus through the health department? Maybe you could clarify that?
Definitely, and we are actually asking even the state for a visual diagram of this as well. All vaccine right now is a federal asset. Each state gets a distribution of it. In Illinois, there are actually 3 buckets that the federal vaccine goes into. One is for the state of Illinois. One is for the federal pharmacy program, which is your CVS, your Walgreens, Hy-Vee. And then the third one is the city of Chicago, because it's a large enough municipality, it gets direct allocation. We take Chicago out of it. Out of the pharmacy program, that federal program was to do our long-term care facilities directly, so that they would go into our long-term care facilities and vaccinate residents and staff. Having gone through that process, our understanding is that any vaccine that they had or were not able to use in a fast enough, they were able to then allocate into their box or their brick and mortar. So when you're looking at a CVS or Walgreens that has vaccine, that is directly from the pharmacy allocation that the state set aside with a partnership with the feds. The state direct one, then it comes down to your local health department. So ours comes from a different bucket completely. And that one is done, it was, in 1A, it was done by your hospital grouping, so we had a lot of 1A because of the 2 healthcare systems in our community, and then in 1B, it's more population-based.
So as you're giving us the 40,000 number, does that include both channels, or is that the channel to the health department that you're reporting out on?
That 40,000 is just the health department. The Walgreens, everyone has a different allocation.
Do we have any idea of what kind of coverage they're providing to their channel? Just as a, kind of as a total coverage in the county, or if it's available?
No, but on the IDPH website, when they do report the number of residents or population that is vaccinated, they are included in that number. So if you were to look at Peoria County right now, we have 56,620 doses administered. That's pulled by where that individual resides. So our state uses what's known as iCare, which is an immunization registry system. So when they are giving the vaccine, they can give it in Springfield at one of the National Guard sites for the state. They'll enter it as a Peoria County resident because they live in Peoria, Illinois, for example, or Dunlop, Brimfield. And so it'll still come in towards our numbers for the population base.
Go ahead, Kate.
This isn't a question, but it's a comment. So I'm in the 1B group because I'm in manufacturing, and I went through the Peoria County Health Department. I just want to tell you that it went very smoothly. It took about a week of going onto the website in order to get a time slot that was available, but I did go and I finally got one, and then I went through the Headington Oaks, and it was just very well organized, so good job.
Thank you. We appreciate that.
Any other questions? Okay. Thank you. Is there any report on care and treatment?
No, there is no report on care and treatment.
Okay, thank you. EMA report.
I will be doing the EMA report
Okay.
as well. In your packet is our February 2021. Again, as you can see, a lot of the significant events relates around our COVID-19 response, as well as we did some EMA flood preparedness work, and then some exercises as well with Kingston Mines. And then we did have to replace some batteries and some of our sirens, and then Jason Marks did present at the Peoria Kiwanis group on actually the COVID response, including the vaccination campaign. More than happy to answer any questions as well.
Any questions? Okay. Thank you, Monica. Appreciate it. Moving on, Beth, Regional Office of Education. Welcome.
Hi, everyone. Good afternoon. Thank you, Randy. My first update was about the vaccine. Just so you know, teachers have been signing up in droves, and you have several teachers that are at least close. I was in one of the first groups of teachers to get it, and I get my second dose this Thursday. So teachers are getting it, and they're wanting those appointments, and they're signing up. So that's great news for our schools. As for the end of the school year, however, as you're looking at that, graduations and proms still probably will not look the same. We're still having to take serious mitigation into consideration when we plan those things out. That is hard on families. That creates a lot of grief and a lot of other things that they have to work through. But it's important that we keep with the guidelines because our schools have been quite safe this year. I want to let you know that the Regional Office of Education is very proud to sponsor the Lincoln Senior Scholars. If you're not aware of this, did you know the statue right outside the courthouse on the corner? Everyone knows Lincoln draws the line. I was a kindergarten teacher at the time, and we raised coins every single week and counted them and donated them, and that's what built that statue out there is the school children in Peoria County. The leftover money from that has funded the Lincoln Senior Scholar Banquet since, 2001 maybe? So a senior from all of your Peoria County high schools, including Peoria Christian and Peoria Notre Dame, and our school, Peoria Regional, nominate a Lincoln Senior Scholar that exhibits the traits of Abraham Lincoln. We always have a nice big banquet. Well, we can't do that this year. So I have been posting videos. So if Steve was the award winner from Brimfield, They surprised him and they videoed it. They gave them their nomination letter to read and surprised them. And we've gotten some really great responses. And those are posted on the Peoria County Regional Office of Education Facebook page. Love it if you would go see those and see your kids and share those, because they deserve that attention. We need more people with the traits of Abraham Lincoln in today's environment. Okay, Safe to Help. I want you to know that several of your Peoria County schools are going to be a part of the pilot project. Safe to Help is a tip line that students can call if they have concerns. Their friends are thinking about self-harm. Their friend has a gun. There is bullying. And so we have several schools in Peoria County that are going to participate in that pilot. I wanted to let you know that. And then the last two things. The Peoria Regional Office of Education is proud to announce that we have accreditation. This is a big deal, my friends. It took 3 years and a lot of hard work, and then they came for an entire week and interviewed my kids at the school and my staff. I let Jimmy Dillon be on one of the stakeholder groups. That's how big, I mean, it was a risk. So lots of interviews later, we are accredited. So you will see that seal of accreditation on my email signature now. We are very, very proud of that, and we're going to be putting it out on our website. Last but not least, I thought this was important enough to bring to your attention, so I brought this with me today. One of the unintended consequences, as there have been many, of the pandemic is we are losing children, and here's what I mean by that. We just recently calculated our county school facility sales tax enrollment numbers. Peoria Public Schools has been averaging approximately 13,000 students, and they are down to 12,500. Every other school district reported a loss except Dunlap, and their increase was smaller than typical. And today we received this email to our truancy department, and I wanted to bring this to your attention. Please find attached 9 referrals from Lincoln K-8. And if you're not familiar where Lincoln is, it is near the old Woodruff. Please be advised that due to the difficult challenges we have faced this school year, our needs as we reach out to Truancy Project Target may be slightly different than a typical school year. For instance, we can't run a typical attendance report off of Skyward as the data is not accurate. We rely on teacher reporting to determine if students are chronically absent, either in person or online. You'll see that there's no attendance report included with the referral packet for individual students, and that is why. I apologize that we cannot provide that information. Additionally, as we reach out to Project Target with these referrals, we recognize that we are referring cases that will more than likely not result in significant attendance gains as is needed to meet your grant requirements. We don't care about that. But they are for whom we have exhausted all of our in-house options or cannot even locate them, but whom we do not want to drop, as we feel that is a dangerous action to take and may result in losing the student altogether. I realize we are referring to Project Target students and families who represent some of our most challenging attendance issues to resolve. However, we felt it was the most appropriate option given our limited ability to locate and or communicate with several families currently enrolled. This is one snapshot in time, 9 students from one school. And that is happening on the daily for months. We are given stacks of students that meet this criteria. And I am bringing that to your attention because we are going to reach a point of an all hands on deck moment where not only are we going to have some unfinished learning from the remote learning situation and some of the struggles that we've had through the pandemic, but now what are we going to do about the ones that are now we can't find or have not reported to school, or through remote learning we have lost contact with? I've only just begun to try to really wrap my brain around this, but if you don't think that this is just an issue for me and that it eventually could be an issue for Sheriff Asbell and eventually an issue, God forbid, for Jamie Harwood or for Jody Hughes, it's all of us. And so I am really thinking through this, and I have tasked my staff with a recovery post-pandemic kind of plan. We're calling it Ignite, Inspire, and Innovate, to think, what do we want to do differently after this pandemic? What are we going to need to do to measure what the learning loss is and to catch kids up? But this was catastrophic enough that I wanted to bring it to your attention. And I am more than willing at any time to have a conversation with any of you. Call me, stop by my office, email me suggestions, ideas. I'm thinking of putting together a truancy advisory board. I'm thinking about putting staff permanently at the wraparound center over at Tree Win. We've got a lot of different things that we're thinking through. And the last part I will say about that is the truancy department that you help support with county dollars is Trudy Schaffner is my director of student services, and underneath her we have 3 people. So Trudy handles the entire county, and then the other 3 support Peoria Public Schools. So that's the resources that we bring to bear. And I do not believe in ticketing. I believe in a case management approach. So we go find these families, we're knocking on doors even in COVID to see what they need. And we're finding that need is a lot. So I wanted to bring that to your attention because it will only be growing. Any questions for
Any
me?
questions for Beth? Go ahead, Steve.
Sorry.
Oh, sorry.
Yeah, the truancy one is definitely a big concern, so thank you for bringing that up to our attention. Wish it wasn't an issue, but it is. So I agree. I think as a county, we need to be on board with you and whatever we can do. Also, I assume you're collaborating with the other ROEs across the state. Maybe they're having similar, what are some common positive things we can do to bring these students back to education? Because education's the right place. It avoids all of the other places you mentioned that they could end up at, which is, not good for the community or any of us. So thank you for working it, but, keep us engaged if you would.
The first answer I'll give you is there's an organization called LUDA, Large Urban District Association. That's Rockford, Decatur, Peoria, Danville. Across the board, experiencing the exact same thing. They're all reporting enrollment loss. Actually, Peoria is a lot less than some of these other areas. So we believe in a supportive approach. We are going to families and saying, do you need laundry detergent? Do you need transportation? Is it Wi-Fi? Is it a device? Is it heat? And anything that we can do to be of support. We are finding a lot of families without the resiliency to be able to face school is the last thing on their mind. And so we are working at it in that kind of approach, and we have a lot of partnerships throughout the community to support families if we can just get them linked to that service. So when I have more, I will certainly bring it to this committee for more ideas. Go ahead.
Is there an opportunity to use kind of a public service type of announcement, some public communication to help those families identify, come to us, we'll help you link to services you need to get the word out on the street, because otherwise the 3 people that are trying to do a truancy really are, that's a chore of endless. So again, think about how do you get those people to identify, oh, there is a service or there is some opportunity for help.
2 responses to that. So we pushed out a lot at the beginning of the pandemic, 211 and the linking to services. But not to be funny, but it's like, you need help with Wi-Fi? Go to this website. The resources, the things that we discovered when we would go door to door is that it's an entire network of families that are not linked to support services of any kind. It is the need immediately for diapers and systemic. This is systemic. This is not, COVID's the great magnifier. So those that were doing well kept doing well and used their services and resiliency to keep doing well, and those that didn't, COVID just magnified it. And so they became even more disenfranchised and disconnected. So chronic issues like transportation is bar none, #1 issue. after transportation, it's all the other things, stable housing and food and all those things that my truancy officer, knock, 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 hi, I'm from Peoria County, I'm here to help. Okay, give me a house and a car and a job and so those kinds of things are a little bit more difficult. But in terms of immediate needs, we're able to tackle some of those things, especially if we find a hungry family.
It's okay.
Go ahead, Brandy. Sorry.
No problem. I had two questions. One was about is there a list for the Safe to Help of the schools that are participating?
I can give them to you quickly. Right now it's Illini Bluffs, Brimfield, Norwood, Elmwood, and Pleasant Valley.
Okay.
And the invitation is open to any of the schools in Peoria County to join the pilot.
Oh.
And it will be going statewide next school year, and any district can be in it that wants to be in it.
Okay. The other thing is, I'm also aware of the truancy issue. I work with Harrison and Roosevelt schools. And with our program, we've had to also go knock on doors, and it's more important to knock on those doors than just making a phone call or those things. So we have been working very hard to reach our parents and find out what they need, because you're right. The education is the last thing on their mind when they don't have food to eat or don't have all the resources that they need. So we've been trying to create a list of those families that we would definitely need to reach out to and connect those students with success coaches or a family liaison that connect those families with the school to kind of be a bridge for services.
And any way we can connect you, let me know. Any way we can be of support of what you're doing and vice versa,
Absolutely. I would love to talk to you more about that.
let's do it.
Okay.
Jennifer?
I just wondered if there was a way to generate a list of students who used support services when school was in session pre-COVID for, food assistance, like as far as take-home meals or counseling or anything like that, that if we had a list like that, we could try to continue providing. I know a lot, schools are still providing meals, but as far as the extra meals for outside of school or the counselor type services.
I do know those are all still available because snack packs were being delivered. They were doing a delivery process instead of having them come to the school to pick all of that up. So I do know that quite a bit of that was still being put into place for sure. In terms of the counseling services, I'm not sure. But we are in close contact with Derek Booth, Peoria Public Schools, because that's vital that we connect to what they're doing, also out in the county to what they're doing. And the issues out in the county, you would think, oh, well, that's it is not different than what's going on here. It's more concentrated in some areas within the city limits, but out in the county, it's the same thing. Transportation, access to services, and then healthcare is even harder out in the county in getting to that healthcare and things that they need in that regard.
Any other questions? Okay, thanks, Beth.
Thank you.
Moving on, sustainability and resource conservation, Becca?
Oh, hi. I thought it would be easier just to present everything from up here. Okay. Thank you. Good afternoon. I just have a few updates in the agenda brief, a few additional items from what was already posted. In education, you'll see we are continuing our Sustainability Sunday posts, so I hope you've seen those on Facebook, and that's been thanks to some collaboration with Gretchen and Jamie. One thing that I didn't note last month that I wanted to be sure that I did note, Landfill Committee is now meeting every 6 weeks as opposed to monthly. The sustainability update, I do have the 2020 usage included, as well as I wanted to let you know with the installation of jail facility lights, they're at 1,549 as of the middle of the month out of 5,000, so they're ticking along. The all facility electrical use charts are included in your packet. From 2019, we were down 11% in electrical use, and you can kind of see a little bit even when people are in and out of the building, keeping in mind those warm bodies with natural gas use in the colder months, and then less air conditioning needed in the summer months with less warm bodies. And then the same thing with natural gas. Natural gas is down 8.4% from 2019. 2011 is our baseline, and so that's why you see that included in the chart. I also did pull out the courthouse, just as a look for the difference between a lot of, with the public coming in and out as well, or not being able to come in and out as well throughout the year, throughout 2020. You'll see that 7.8% down 2020 from 2019, and 1.8% down natural gas usage 2020 from 2019. Water continues to go down across most of the facilities. Some of them are staying about the same, but most of them have continued to decline just through different sinks being put in, and also a lot less people in the buildings this past year. The fountains weren't filled at the courthouse, things like that. Chairman Williams did ask me to do a presentation on the sustainability plan. So the sustainability plan was adopted in 2011, so we're coming up on the 10-year anniversary of the sustainability plan, and that's why you see energy tracking and water usage tracking, although less frequently, in your packet. I try to report that quarterly, but I also wanted to go back and tell you a little bit about the sustainability plan, since it's been 10 years since adoption. We've done some updates. Normally the sustainability team meets quarterly. We look at sustainability projects across the board. We have some criteria for funding that the projects do meet some of the goals and objectives of the sustainability plan, and then there is a fund that was put in place with the adoption of the sustainability plan for funding some of those improvements. Past year we've met a little more frequently, and we are looking at some updates to the plan for the 10-year anniversary. Certainly there were a few things that needed to be updated. A lot of the lighting has been updated, but there also, it's been 10 years. So we did a progress report in 2016. We did a 5-year update in 2016, and then we've done some progress reports along the way, and then continuing to report to you quarterly. So let me run through the sustainability plan a little bit, really quickly. There are 6 sections of that sustainability plan. It was driven by the county board. It's just looking at internal operations. It was a team of a cross-departmental group of employees, as well as a few people from outside, from the Sierra Club Global Warming Solutions Group, also helped us to write this plan. It took us about a year. There are 6 areas: buildings and construction, operations, land use, purchasing, solid waste, and employees. Let's see if I can go forward. Oh, too far. Buildings and construction looks at the buildings themselves, and then at that point when the sustainability plan was adopted, the Peoria Riverfront Museum was being built, and Huntington Oaks had not been built yet. The plan does call for any new construction to be built to LEED Silver certification. LEED is just a third-party certification for buildings. Leadership in Energy Efficient Design. Okay. So across buildings and construction, we're going to look at the increased use of renewable energy, as well as the buildings and the envelope and the lighting and anything we can't shake out of it. Operations looks at what we're doing, policies that are in place, things like scanning and storage, Energy Star appliances, the reduction of usage of fuel at fleet. Land use, we don't have a ton of land. Most of the land that we have, we do have some farmland, I know, but most of the land that we actually have is the right-of-ways along the roadsides. That was one area that we really could look at, as well as native plantings and use of perennials, so that we're reducing our water usage through irrigation. And then highways mowing smart, so like mowing at the end of September, so that the plants could grow back, and there's a natural snow fence, but also doesn't limit visibility. Purchasing really just looks at, like it says on the slide, remanufactured, renewable, and recycled products. The employees section, there's a lot of us, and what we do makes a difference here at work, but also we want to work on education so that we're going out as residents, right, to also have an impact on the amount of natural resources we're using. The plan across the board looks at reduction and reuse, sustainable use of natural resources as well as financial resources. And that last section, solid waste, just deals with proper disposal, composting, and recycling. So like I said, for buildings and construction, we're looking at those lead buildings, the HVAC, the lighting. That was a shot of Headington Oaks, obviously, and that was a gold, silver, or gold certified lead building. Operations, a lot has been done since adoption with scanning of documents in the recorder's department, for instance. Land use, there have been a lot of native plantings done at JDC, as well as they have a wonderful garden for their residents. They have a vertical garden. They have composting on site, not only for the things from the garden, but also food scrap composting for the lunchroom. That started a couple years ago. I hit a few slides. There's a delay. Sorry, so I'm going a little. Okay. The purchasing section, we did look at the purchasing policy again in reviewing the sustainability plan. I'm happy to bring those updates to you for your recommendations going forward and let you know where the sustainability team is at this point. But it does look at cooperative purchasing, reduction of transportation emissions, as well as, again, that's sustainability in terms of financial resources with that cooperative purchasing. The cleaning contract calls for green products to be used. The employees section, we branched out and created the Green Crew. CREW stands for Conserving Resources and Educating Workers, and that's our green team. And we've done a few collection events. We also do an educational newsletter, some giveaways, and are part of monthly new employee orientation. We've won a few awards throughout the years. In 2016, we were given the Governor's Award for Sustainability. There's a picture of the lead plaque at Headington Oaks. And also we participated in the Green Office Challenge as well, and got third. Stayed third. We tried really hard. And then again, the solid waste section really just looks at making sure that we're safe disposal and collection of anything, and also gives us an opportunity to look for other ways to save some energy or reduce the amount of trash that we're generating. Again, I do report quarterly with some of this information. We do use Energy Analyzer from Ameren as well as their website. I use Portfolio Manager from the EPA that looks at normalized weather, data that's normalized for the weather. This is just a snapshot from Energy Analyzer that shows us, this is showing highway in February of 2020, so a little ways back. But the weather and the time of the days in the cycle lined up pretty closely. I mean, 21 is different than 30, but still you can see the difference in the usage there, with the blue being 2020 and the green being 2019. Highway did have a large update of lighting, and that's why I was showing this. I think just some Ameren folks probably should have hit that slide. The highway electrical usage, I did throw 2020 on there before this meeting. It wasn't on there when I met with you last week. But the highway Plank Road facility, so the fleet garage as well as the maintenance garage, the whole facility, did get a lighting update that was finished in July of 2019. And that included, as you see on the slide, a large number of lights, including external lights, replacing the high intensity diodes. Oh, actually, I could tell you some minutes. Yeah, it started in midsummer, but wasn't completed until August. 42 lights on. JDC's electrical use. JDC also had a lighting update in 2019. Theirs has been going on throughout the years, but the largest section of it was done and completed at the end of February in 2019. 2020 used 14% less than the average usage from 2011 through 19. So it looks pretty good. And that's reflected, of course, in their budget as well. This is the health department also had a large lighting update, all of theirs, including some external lights. 111 T8s were replaced to 578 LED strips, so pretty big difference. They had a reduction of 15% 2020 over their baseline of 2011. And as you know, the health department was utilized quite a bit this past year. Even if there weren't employees in there, they still had things on the weekends, the testing, COVID testing. Parking deck lighting, this was done in 2017, so a little while ago. But I think one of the things this is just a small thing that I had pulled out previously, budgeted $17,000 in 2018. The actual use was $8,000, so 2019 the budget could drop, right? So we could do that I can do that for other departments too if you'd like to see that. In terms of extending our reach outside of just internal, we do, of course, educate the community as well, and we've done that through our Sustainability Sunday posts. Some of you participated in the video a couple years ago that kicked off our Sustainability Sunday posts. So we update our HVAC, keep that running. So at home, that means changing your furnace filter. So just those kinds of reminders for folks at home. We have building automation to make sure that the buildings are, the temperature is staying what you want it to be in different zones of the building, so the HVAC can work efficiently. At home, you can use a smart thermostat, right? That's going to know when you're home, when you're not home, when you're about to come home. Kind of scary. So again, we just reminding the residents as well as the employees to go green with Peoria County. Are there any questions? It's probably a little longer than you might have wanted, but.
No questions? Okay, well, we really appreciate the update and what you're doing in your department, so. Okay, moving on, we are at miscellaneous, and I believe we do have a miscellaneous.
Thank you. Just quickly, this has been something that we've been working on regarding our vaccine clinic, and I'm pleased that it just got finalized about 5 minutes ago. The Peoria City County Health Department with the Illinois Department of Public Health and the Illinois Public Health Association will on March 2nd be hosting a forum on the social determinants of medical mistrust and vaccine hesitancy. And I would just, we'll send out information for you to be able to watch as well, but our panelists are Dr. Zike from IDPH, Dr. Spiller from ICC, Dr. Arnold, who was formerly of IDPH as well as now UI Comp, and then lastly, our very own Dr. Armour, who is our Board of Health President. So again, this is really exciting, and is really trying to address not only the historical references around medical mistrust by individuals of color, but also then discuss vaccine hesitancy and really have direct answers about what has gone through to actually make this vaccine, so address some of those concerns. So very excited. It just got finalized, but we'll be hosting it actually as a statewide call. So hopefully you guys can also log in and watch it as well. Thank you.
Monica, I did hear this was happening, but when did you say it was?
March 2nd at 6 p.m.
Okay, thank you.
Yeah.
Okay. Any other miscellaneous? No? Okay, we're adjourned. Thank you.